Welcome, everybody. We're just gathering everyone in. It's right at 4 o'clock. So happy to see you all. Okay, we've started recording. Just to let everybody know, you're going to be muted upon entering, so that when you want to speak later, you will have to unmute yourself. We're muting you intentionally so that things remain quiet for us and we can all hear each other. So welcome, everybody. We're muting you upon entry, and you will be able to unmute yourself if you have questions or comments later on. Hello, hello, hello. Lots of people that we know are getting on. Welcome all. Okay, so we are gonna get started pretty soon. What I would like to do first is, for those of you who may need Spanish interpretation, I'm going to have Lorna speak about how to do that in Spanish. So go ahead, Lorna.
Para las personas que necesitan interpretación simultánea al español, pueden llamar al 551-241-6310. De nuevo, 551-241-6310. No se necesita código de acceso. Gracias. Thank you.
Thank you. Okay, welcome everybody. For those of you who've never been on one of our calls before, my name is Judy Mark. I am the president of Disability Voices United, which is an organization directed by and for people with disabilities and family members. And I also have a son who is in the self-determination program and is living a great life. Just had his personal trainer come over and work in our backyards from 6 feet away, and that's being paid for by the self-determination program. So let me just tell you all how this is going to work in case you've never joined us before. We're going to have presenters, several presenters. You can, if you have any questions about the technology that we're using, the translation that we're using, anything like that, you can put that in the chat. If you want to share information with others, like here's a good website, here's something I know, you can put that in the chat. But don't put questions that you have for me or for any of our speakers in the chat, because the chat usually gets a lot of activity and it will be hard for me to see what's going on in the chat. So the way you're going to ask a question is to go down, and even Connie Lapin knows how to do this. So that means everybody knows how to do this. Is to go down and click on participants. You'll see that you can choose the raise hand feature. I'm going to raise my hand. So you see above my face, there's a little hand. If you actually physically raise your hand, I will not be able to see it. There are so many people. We sometimes get up to 100 people on these calls. I will not be able to see you physically, like raising your hand. So you will just need to use the system here to raise your hand. I'm also going to make sure to give the opportunity for those folks who speak Spanish on the Spanish line to ask a question. I will do that later on in this webinar, in this meeting. So you will be able to ask your question to the interpreter, Lorna, who will then let us know what your question is in English, and she will translate our response. All right, so let's get started because we have amazing presenters today. So today the topic is how to select service providers. And by service providers, we mean everybody who supports you in the self-determination program, from person-centered planners to independent facilitators, to your FMS, to your direct support people, to your activities that you do in the community, to anybody that you will have to hire, any individual. We are here to help you. and by some people who are already in the self-determination program, one of whom has been in for over 20 years. So the first thing I just want to do is just to, hold on, I'm going to get rid of my email so that you don't have to hear my email coming in all the time. So the first thing I'm going to do is share my screen. Hold on, I just messed that up. I'm sorry, people. I'm going to share my screen. Let me find what I want to show you. So the first thing I'm going to do is to show you where you can find this information I'm about to share with you. So this is the DDS website. And so the way you find this is to go to, so you can either search for the self-determination program or you'll find it under services on the DDS website. And then you're going to want to click on training and other. So if you go to the self-determination program, you'll see, if you go down, you'll see that there's a lot of different materials. So you then want to click on training and other materials. And then you will see that these materials are in a variety of languages. We're going to use English today, but it's also in Spanish, Chinese, Laotian, many others. And the one that we are looking at today is called hiring service providers. Okay. And it is a Word document that you can download, but it is also available in our book that we sell from Disability Voices United called Thinking Outside the Box. Oops, I didn't want to go that far, sorry. And this is our printer's copy. So it's not a copy that you will be able to get. We don't sell it online. We only sell the actual physical book. But this, I wrote this piece, much of this piece with the help of many people for the orientation. And so we're going to use it today. I'm not going to read everything to you because I encourage you to just go on the DDS website and find it. But, or you can get our book, which has many other features to it as well. But I just want to point out a few really important things. So, you know, one of the most important things that most of you know is to ask for help from people you trust. Don't ask for help from people you don't trust, because that doesn't make any sense. Like, don't ask like total strangers, because you need to pick providers who are going to understand your needs and know your community and who you are comfortable with. And it gives you some options of how to do that. You can put an ad in the paper. You can ask for resumes. You can find an agency that can recommend workers. And then we talk about how you should schedule an interview. I mean, now is a different kind of time, but in pre-COVID days, you were having in-person interviews. Now you may be doing it on Zoom or on the phone. You want to make sure, this is so important, people don't do this, is to call their references, ask for references. If these are individuals who are going to be working directly for you and you may have concerns about any of their background, you should be calling their references. And then you also want to have a service provider agreement with people to say exactly when they're going to be working, how much they'll be paid, so there's never any confusion. Your FMS can usually help you with things like that as well. Remember that if they're providing personal care, they have to have a background check, which right now does not require a fingerprint during COVID, but you still have to do a background check based on your Social Security number and driver's license or ID. So then I just wanted to highlight that we have written specific questions for the different kinds of service providers, including questions for independent facilitators and also person-centered planners, who are those individuals who can help you with your initial first person-centered plan. So you want to ask them, what experience have you had? Have you ever facilitated a person-centered plan? If they say, no, I never have, that doesn't necessarily mean you won't hire them, but you're going to want to ask, well, how are you going to do it if you've never done it before? one of my concerns is there are a lot of people out there as person-centered planners who are just learning how to do this, which I think is great. I've trained a lot of them, and I think it's the only way for planners and facilitators to learn how to do this is by practicing it. And you are likely to be one of the people they're practicing on. But that means, you know, right now you can get up to $2,500 to facilitate a plan. And even though it's not coming out of your pocket, and even though it's not even coming out of your budget, I just really want to give some warning to everybody that you shouldn't be paying a person who has facilitated 1 or 2 plans or never facilitated a plan before. You shouldn't be having the state, our taxpayer dollars, paying them the maximum amount. So you need to be good stewards of our program. And this is not just a way for people to get the $2,500. This is a way for people to provide you service. And you should be comparison shopping to people, with people, okay? You want to ask them very specific questions. How well do you know my community? If you're hiring a person in Northern California and you live in Southern California, how are they going to know of activities in Southern California that you might be interested in? So you have to be really thoughtful about that. You also want to ask them, you know, there's some planners who are just providing, they're just doing the person-centered plan and not doing anything else for you. That I made that choice for my son because I had a planner who was very, very highly experienced, who was only going to help me with the plan. But I also knew, because I'm kind of an expert on self-determination, that I could do those other pieces myself. I could advocate for my son, and I could figure out his budget and his spending plan. I didn't need other people to help me with that, but most people will need that help. So if you're going and hiring a person who's going to help you create a written plan and then walk away, that may not be the right thing for you, because then you have to hire a whole other person. You may not have enough money left in your budget, your $2,500, to have somebody help you actually create a spending plan and advocate for you at your IPP if that's something that you need. You may also want them to help you manage workers and other kinds of things. We also have some specific questions when you're looking to hire an FMS. Many people are just hiring an FMS because it's on a list that the regional center gives them. That's not the way to do it. You really want to have a conversation with them and actually interview them. You know, you first, obviously, we've talked about this before, which model of the FMS you want, and make sure that this FMS provides your model. But you want to ask them questions like, how are you communicating with me? If they say, well, we only communicate by email, we don't do phone calls, that may be fine with you, or that may not work for you. You may need someone who answers the phone whenever you call, or you may like texting. If you have a question about development of a budget, can you help me? How will you get timesheets for my workers? I mean, these are questions specifically for the FMS, and I encourage you to ask all of them. We then have questions for general service providers. Many, you know, how do you provide services in a person-centered way? Will I have complete access to the community? We also have specific questions for personal care workers. These are people who will maybe help you, you know, with intimate issues like showering or toileting, and you want to make sure that you're safe with that. You also may want to make sure they're being really person-centered. So how would you learn more about me to work with me? Like, these are questions that a lot of people have never been asked before. I have certain things that are really important to me. Like, how are you going to make sure you're doing those things that are important to me? We also have questions for agencies. You know, in the traditional system, people don't ask questions to the agencies. They're given an agency by the regional center and they say, okay. Well, now you have choices of agencies. So this will give you the chance to look through, to ask them, what is it, will I be able to choose what I do each day and who I spend my time with? If the answer is no to number 5, if they say no, I will not be able to choose what I do each day and who I spend my time with, I can promise you that is not an agency you are going to be able to use during the self-determination program, And we will get this in a future SDP Connect to really talk about what does it mean to have full access to the community and to abide by the home and community-based services rule. And finally, we list the questions you cannot ask during an interview. We don't want you to get, a lawsuit against you. You are legally in the state of California not allowed to ask a potential candidate's age, whether they're married or have children, their gender, their sexual orientation, race, religion, whether they have a criminal record, or what their previous salary was. These are big no-nos. So you have to make sure to know that as well. All right, so I'm going to stop sharing because I know there's been some activity in the chat, and I know that, and I want to really get to our presenters. These questions are all online, and I'll be sure to put in the chat, if somebody hasn't already, I'll be sure to put the link to the DDS website and how to find them in the chat. All right, so now we're going to move on. And I want to introduce the birthday boy, my friend Howard McBroom, who is a self-determination participant in the Lanterman Regional Center and really has been one of the big leaders in the self-determination program and sits on their advisory committee. So Howard, you're going to need to unmute yourself so that you can present. Perfect. And Howard, why don't you tell us a little bit about how you have selected your independent facilitator, FMS, and service providers.
I will do so. Thank you, Judy, for giving me can you hear me?
I sure can. You sound great.
Okay, good. Thank you, Judy. My name is Howard McBroom, and I am indeed in self-determination, and I'm going to tell you about how I selected my independent facilitator. Originally, I was going to ask Sherry Beamer to be my independent facilitator. I was on the board of directors of the Lanterman Regional Center for 7 years, and she was my board consultant during my first year or so of my term on Lanterman. And well, her, I would not have made it through the board training. And I was going to ask her to be my independent facilitator, but she was moving to Maryland. So that left that out of the question. I asked her who she recommended. And she replied, Shawnee, that she recommended a woman named Shawnee Sanders. And she felt she was very highly recommended, very, very good. And so I asked to meet with Shawnee, and I met with her in the office of Brian, our program director at my day program where I worked at. And I was immediately impressed with Shawnee. I asked her, what experience she had and everything, and she just seemed very competent, very together. And when I told her about my website, I told her that was the #1 thing I wanted to do with self-determination, and that I wanted to use it to stop mass murder, all the mass shooting. And she said that it would be her honor to work on this incredibly important topic. And when she said that, I knew I had my independent facilitator. There was just an immediate bond between us, an immediate bond, an immediate conversion of interest. And right then, when she said that I want to work with you on this incredibly important topic, I knew I had my independent facilitator. I knew I had her. And I don't think I could have made a better choice than Shawnee. I truly don't. Frankly, I think Shawnee's the best there is. I know I haven't known any other independent facilitator, but I still think she is the best there is. And certainly I could not ask for anyone better. She worked for me for a long time without pay because she believed so much in what we were doing, and also because we had the bond between us. I can't explain it any more thoroughly than that, but there's just this bond between us that, strong and good. And I think we understand each other on a level most people don't. And when you ask me what I would look for in choosing an independent facilitator, my answer is this. You want to hire somebody who will fight for you. You want to hire somebody who believes in you and wants to work with you and accomplish your goal, which Connie certainly did. And You also want somebody who's highly competent, capable, knowledgeable, somebody who will fight for you and not stop until the job is done. And those are the qualities that I would look for in an independent facilitator. And I also want to say one more thing. I cannot imagine doing self-determination without an independent facilitator. I truly cannot. I know you don't absolutely have to have an independent facilitator, but I, for one, could not begin to imagine doing it without somebody else. I certainly could not begin to imagine doing it without Connie. I mean, she is my rock, my linchpin in self-determination, and together we have accomplished a great deal. We got my website now out. The domain has been married to the Google or whatever, and it is now out there in the world. I got my novel typed up, and I am getting the support I need for my medical needs now. I am having no trouble in my legs. I have an autoimmune disease that is attacking the nerves in my legs, which I did not have when I first met Connie and Brian after 2 years ago. But Connie, I just want you to know, you are a wonderful person, and you have done great work for me in self-determination. Thank you very much.
Thank you, Howard. That was beautiful. I particularly love your biggest advice, which is hire someone who's going to fight for you. Hire someone who's going to stay with you until you meet all your goals. That's exactly, that is awesome, awesome advice. Thank you, Howard. We're now going to turn to Connie and Harvey Lapin, whose son, Sean. Connie and Harvey helped to write the law of self-determination. They're experts at this, have been in the field for many, many years, and their son's been in the program for a couple months now. And so, but I actually asked them to talk even more about, more than just the self-determination program, because they've been hiring staff with their son for decades now and do it in a very inclusive way. And I wanted them to share that to make sure that people, no matter how impacted by their disability, are able to participate in selecting their own staff. So go ahead, Connie and Harvey, take it away.
Okay, well, I'm going to start because I don't like nouns, but I like adjectives, adverbs, and predicates. So Connie's going to interpret.
So I just want to say I'm going to be his translator and his Vanna White.
Right.
But I'm going to say something at the end.
Right. I love the questions that you ask. This is a paradigm change, a systems change, and it's not easy. And I believe with all my heart and soul in the person-centered plan, because that is the foundation of self-determination. And, you know, picking a facilitator in our situation is very difficult because Sean, even though many years ago we brought typing out here to California in 1992, I think it was, Sean has shut down. He's basically nonverbal, but believe me, he can let you know. And we picked a team together, but it was really Sean who picked it, okay? Because he has his ways of telling you. We did our person-centered plan because I've been going back to Michigan. The Self-Determination Center of the United States happens to be in my hometown and Connie's hometown, Detroit, Michigan. And they do some pretty good stuff there. Tom Nerney was there, and Tom Nerney is kind of the father of self-determination. At least I consider him that. We had a person by the name of Sally Burton Hoyle. And, you know, in a way, indirectly, we interviewed her when she came out here. I knew her. I met her in Detroit. I knew her husband in Detroit and the people that were, I think, doing it well. And she had a brother, very much like my son, Sean, who spent most of his life in a state hospital. He passed away, but he did have some good years outside it. And her stories about him really reminded me of Sean. And when we met, Sean just like glue took to her. He knows. I honestly feel our people have a sixth sense. They know people who care. And she was the one that did our person-centered plan. Even though we went outside that, she's in Michigan. Michigan on a university level teaches person-centered planning. We don't do that out here. So when it became time for the facilitator, we have Joe Donafio and John Francis. They kind of specialize in different things. Sean is quite intense. There's 9 staff in his life. It took time. And first Joe, who is a soft-spoken and teaches also person-centered planning, they had to get to know each other, Sean and Joe. He may not like him. Okay, I like him, but he may not like him. And John Francis, I met when you did not go to the self-determination meeting in Sacramento. He was there representing North LA Regional Center, and we got to know each other. He's a warm, nice guy. But we didn't hire him at the beginning. He met with Sean quite a few times on his own. And Sean took to him, and Sean likes him. Basically, those are the ways you get to, to the people we're talking about. Other people that are involved, these are providers that are vendored and send their bill to our fiscal management service. Dr. Ruth Myers, wonderful person, who's known Sean. She's a psychiatrist for 22 years. And they're close. They love each other. This is what I'm trying to get to, is if the customer, and those are our people, don't accept the person that is coming into their life, or they know them, it ain't going to work, period. It's got to happen with people you want on your team. Who else came into the situation was Darlene Hansen. I've known Darlene since 1992, I think.
Can I interrupt you for a second, though? One of the things is, if I were listening to this, I would say, well, God, I don't know any of these people or all these people. We are lucky in that respect. We're old. My son's 52. And so we've been around a long time. You can get to know these people. You can get to know what's out there if you are on like webinars like this and involved in your local self-determination advisory board. And now with Zoom and us being remote, you could attend all 21 of them.
All kinds.
And information is power. I mean, we are in I guess, a good and a bad situation. We're octogenarians, so we're old and we feel our time's running out and we need to get this working. Sean is able to say who he likes and doesn't like. I mean, when he moved out of the group home, this is just a story though, but it resonated with me. When he was in the group home decided where they went. When he went to supported living, which I thought was actually self-determination, although I didn't know how to say it then, the group home decided to visit Sean one day. They didn't call, they didn't ask if Sean wanted him. And Sean, I wasn't even there. His support staff told me about it. The doorbell rang and there was all 6 of them at the door. And they started walking in and Sean said, bye-bye, bye-bye. He actually
He threw him out.
He also actually kicked out George Stevens, and who was the director of North LA Regional Center, who came. I said, you've got to see the supported living arrangement. What I'm trying to say, and they came, and then somebody said, well, what goals are you working on, Sean? Now, that's not what, Howard, you want to hear. You want to hear somebody that has your back. And one of the things I've learned is that they don't have to be all that experienced if they've got your back.
Right. In fact, I'll get to hiring staff. I've learned that one the hard way. Okay. Basically, going to the FMS, I did a lot of research on FMS. Going back to Michigan, I met with Wayne County, like a regional center, Macomb County, like a regional center, and this is where Tom Nerney was. And what happened is I also had lunch with a person and we got to know each other, Annette Downing. Annette Downing has actually spoken to ARCA. And Annette Downing I asked her advice. I asked, who would you go to? I've learned the hard way, I believe totally in sole employment, totally. Why? I'm certain of one thing in life, things change. I've started a supported living agency and left. Why? You're not in charge. The customer has to be in charge, Sean. And I wanted a FMS who had the same values that I had as far as person-centered and gave you the support you needed and had experience. And I'll say it again, experience. I went with GT. They have 25,000 people. That's just me. I want to have someone who's been down the road, has experienced what can go right and what can go wrong mostly.
As an FMS.
Right.
But we're talking about
And
independent facilitators.
No, I went over to we talked about that, okay. But getting to Sean. Sean is the barometer of this whole thing. How do we, I'm gonna show you guys something, how naive I was about staffing and all that, because I didn't have a background. I'm an advocate. See this book? These are all names we interviewed, okay? We went to Indeed, care.com, not good in our experience, okay? Networking, yeah, okay. Brad, actually, our other son, who's in it, has gotten us 3 of the people out of all the staff. Why? He brought them in, and he introduced them to Sean, became friends, and of course, if Brad's a friend of them, they're like brothers. That's how it works. But networking, I think, is the key way to really try to find decent staff. And we always have had a trial period with Sean. Sean is the barometer. It could take 2-3 months. They come, they get their minimum wage, they're with Sean, and if Sean takes to them, and if he doesn't like them, he'll take them to the door and throw them out, okay? And believe me, he will. And Sean, right now, we've finally got people together, and we're on, I don't count us being in self-determination up until a week ago Monday when we had full staff because of glitches, okay? Sean is now gonna have a shot at life. What is a person-centered plan? The dreams and wishes of our people. We have never had a level playing ground, ever.
So I don't know how much time we have left. I just want to add that when you are doing this, finding an independent facilitator and staff, you're going to make mistakes.
Oh yeah.
And one of the things that resonated with me a lot is when we were trying to sell self-determination, we were told, well, what if something goes wrong? What if somebody gets abused? What if something blows up? And I'm saying it doesn't in the traditional system. I mean, it's so bad in the traditional system because you have no recourse. You're not in charge. And with self-determination, you can make choices. You know more than you think. You are in charge. And I believe, like Howard said, I believe in the beginning you need more support. So a good independent facilitator, it's money well spent in the beginning to help you. Information is power, and I said that. And the most important, not most important, there's so many most important things. How do you think out of the box? We don't know how to do that. John's 52 years old. Howard, you did. Howard's amazing. But a lot of people are stuck in and kind of brainwashed in the system that we exist in. And so when they think out of the box, they only think about what is available, not what is possible. And that's where the person-centered plan, talking about dreams, and the independent facilitator helps you think out of the box. If you just get the same program that you are in now, that's not self-determination. That's all you know.
A fascinating thing happened with the department on participant-directed. First thing they went to when this pandemic came out there is participant-directed. Why? It takes away a lot of the bureaucracy. That is really what has hindered us. If we don't, and I have to make my statement on this, learn something from this pandemic, that we can do business different and better, okay? We don't have to have these Taj Mahal buildings and things like that. Why? That's the old medical motto, and it's going to be a thing of the past, because if we don't learn, we are dumbbells.
We're thanking you for letting us in the same room and talk at the same time.
She kicked me
You guys were
times under
amazing.
the table.
Everybody in self-determination is required to watch that, what you just talked about. That was amazing. You're getting claps. I'm seeing a lot of people doing this video.
Howard, thank you.
So,
buddy.
so while it wasn't advertised, because I just confirmed it today, I am so thrilled that our next speaker can join us, Rick Wood. Rick, by the way, you're invited to every single one of our SDP Connect calls, because you can add to all of these conversations. This week, by the way, thank you all for joining us at 4 o'clock instead of at 5 o'clock, because I have a meeting at 6 o'clock with my local advisory committee. But so Rick's son has been in the self-determination program since he was a little bitty guy out of Kern Regional Center. And Rick is also the chair of the statewide self-determination advisory committee, and is a definite expert on the subject. And I asked him to just kind of talk about how did he pick service providers for the last 20 years, as well as sort of advice for people in the new program. So go ahead, Rick. Thank you for joining us.
Sure. Thanks, Judy. You know, it is so great to hear from people like Howard and also Harvey and Connie. I've known the two of them now for, I don't know, I think it's about 7 years, and I am I always take something from what they have to say. Howard, you were so eloquent in the way that you presented. My story is similar and perhaps a little different. I'm just so fortunate to have had my son, who's going to be 25 next month, selected for the Kern Regional Center pilot 21 years ago. And a pilot is just that. There were no rules. Harvey suggested that, you know, self-determination is not easy, or getting it going is not easy. I would actually put it a little differently. We didn't have any rules, and I think it probably made it a little easier than it is now. But it was also harder because it was challenging. And that was not just because we had to change our perspective. It was not because we had to have a paradigm shift, which we've often talked about, but it was because we didn't really know what to do. And so my son, who's got a complex issues, medical as well as developmental, was not receiving services that I thought were improving the quality of his life. But I didn't know what would improve the quality of his life. What I knew is I didn't really like the system, and I didn't feel like that he or we as his parents were in control. He was only 3 at the time. And so we were fortunate enough to be able to be given a very long leash, and we were very creative. So I became an independent facilitator. I didn't go to school for it. My only client was my son, and up until, believe it or not, Judy, July 31st, I'm still his independent facilitator. On August 1, we are transitioning to the SDP as it now exists. I was also his FMS. That doesn't mean that I was in the business of being an FMS, but it was because I wanted to control the funds. And we operated as a sole employer all those years, and will all the way through July 31st of this year. And so, you know, in thinking oh so long ago about how we did things, Kern Regional Center gave us the opportunity to essentially develop the rules as we went along. And so we went out and we found people in the community that had been somehow connected to the developmentally disabled community. So for example, we had one person who was in an early start program. She was an early start teacher. She was committed to those at a very young age with developmental disabilities, as well as medical issues and other physical disabilities. And it sort of grew from there. And over the course of time in this little community, I haven't mentioned it yet, but I live in a little town called Mammoth Lakes. Mammoth Mountain is a ski area. Mammoth is a ski resort. It's in the Eastern Sierra. We have only 8,000 people in our town, but we have 40,000 people descend upon us, COVID or not. And so the town feels a lot bigger than 8,000 people, but we're very isolated. And so we had to be creative about the things that we wanted or thought that we needed. And Connie, you just said it so well when you said it's not about what is available, it's about what is possible. And so we shifted that paradigm, and we thought, well, what do we do first? Well, the first thing we do is develop a plan. And now we've got an opportunity to have people who want to be person-centered planners, who can get paid to be person-centered planners, who I think in many instances will be independent facilitators. I think there's an overlap in the skill set or sets that are required in order to do both of those things. In our instance, we developed our son's plan. We did it with the help of the regional center, the service coordinator. We did it with some creativity on our part, thinking about, first of all, what are the dreams? What are the goals that follow that? What are the objectives that follow the goals? And interestingly enough, they changed over the years. My son was 3. He's now 24, almost 25. And so over a long period of time, in fact, every year the goals change because life changes. And so I sort of learned on the job and went out into the community to think of things about how we could do things better and provide a similar service as was being provided under the traditional delivery model. And then also new things that had never been tried before, were not authorized, did not have a code, and would never have been approved under the traditional delivery, which, such as for years ago, we trained a service dog. We didn't buy a service dog for $20,000. We trained a seizure service dog. We used our funds and developed a budget to actually have my son's mother, my wife, train a dog for 2 years who became his service dog. And sadly, just 6 months ago, the service dog passed away. And that was like losing a child, frankly, because that service dog was such an important part of our life and his life and our family. So when you think about going out and speaking to people about how they might be able to help you in whatever capacity, whether it's a care provider, whether it's an FMS, whether it's an independent facilitator, whether it's a general service provider, 1, you need to be creative and thoughtful. 2, it's very personal. It always will be, and it always has been. You can't be afraid to walk away from somebody who is selling you on something and you're not comfortable with it. The questions that were put up on the screen when we were sharing it are really important. Interviewing is really important. Rejecting people in the event that you're just not comfortable. Allowing the person, in our case, our son, to weigh in. And he's not verbal, but he will tell you if he doesn't like a person caring for him. He will tell you. He can't say, I don't like you or her or him, but he will behave in ways that that tells us that there just isn't something right. And don't be afraid to fire. If you don't like somebody, don't be afraid to fire. Now, I understand it's hard to get care providers. We have 6 full-time people, 24/7 caring for our child. We've been through many, many people over the years. The difference between the traditional delivery and us is that 1, we don't have an agency here, so we can't use one. And so we're out there looking in the community. But the difference is that they're not looking for us. We're looking for our son. And he is then approving by telling us whether or not he's getting along with the people who are caring for him. And so the hard part is that you have to be vigilant. It's constant. You have to be on it, but we are anyway. We are whether or not we're in the traditional delivery model. So 1 is personal relationships are really important. 2, networking. I heard that word earlier. I think Connie or Harvey used it. Over time, we as a group in our little area learned what other people were doing without violating the confidentiality requirements. We learned what things were available out there. We learned what was cheaper, less expensive. We learned how to negotiate with providers. All of that comes in time, and the people that are out there that will be entering this cottage industry that is going to grow up called independent facilitators, are people that can help you do that. So there are people who need to know the community. I believe they need to be people that know something about developmental disabilities, but you don't have to have them. It could be the next door neighbor, because you trust that person and you love that person and you're willing to work with that person and even teach that person a thing or two. So we're not restricted. We're not restricted by titles. We're not restricted by education. We're not restricted by experience. There's a whole lot of, sort of gut feeling, if you will, in this. And so all of us have, I think, the same kinds of issues, and it's really a matter of being, really fully engaged in that process. And most of all, what I would say for those who are not yet in, it's 21 years, and I said it on a video that came out many years ago, that we don't know what we would do without self-determination. Our lives would be so much different. And now that we have this program, it's different from the pilot, but mostly the same. And the principles are certainly the same. But what I would say is, if you're daunted, don't be. If you think that you can't do it, reach out to somebody else who has, because this little community is going to grow, and we're going to be able to share information to make it easier for you to transition into this program from the traditional delivery. And I mean that from the bottom of my heart. Rely on other people, and it's going to be challenging, but in the end, you're going to find that life is so much better that you're going to say, wow, this is really easy, and I would never do it any differently.
Thank you, Rick. That was amazing. I feel like this whole webinar needs to be required viewing of everybody, because each of you had such important wisdom. So I now want to give an opportunity for those in the audience to ask any questions or provide any comments or make any suggestions. You can do that by going into clicking on participants at the bottom of your screen and raising your hand. That would be, don't physically raise your hand because I cannot see everybody. But if you raise your hand, then I can call on you. I'm not seeing anybody yet, so I will just say a couple of things. It's so important for people to not be pressured in one way or another to hire certain service providers, to you may have a friend who recommends an independent facilitator, or a friend who recommends an FMS, or somebody to work with you directly, and it may not be the right fit for you. And do not feel like you have to say yes to that. This really has to be about yourself and what works for you. And if it's not working out for you, if you hired an individual staff member, and that person's not working out for you, the great thing about self-determination is you can get rid of them and hire a new person. You don't have to get permission from anybody to do it. So it's really great. Okay, so while I was babbling on, we had a few people. So Connie, it's not Connie Lapin, I don't think. Now it's Connie, do you want to go ahead and unmute yourself? Go ahead.
It's Connie Boyer.
Hi, Connie Boyer.
Hi. So I really liked what you said about it's not what is available, it's what's possible. But one of the questions, because we're just entering self-determination, is that if you have a really challenging adult child who's big, who gets protective supervision 280 hours, who basically the wages are lower than what a regional center offers under in-home support services. And so your budget is impacted, first of all, because you're not getting as much as if they weren't in IHSS. How do you find people who, because it's not really a livable wage? I'm just very stumped as to how I'm going to find this. Can people supplement, these budgets? How can it be done when you're really impacted by another system, basically, and because the wages are too low? I live in Silicon Valley, and it's very hard to get providers that are sometimes even trainable or speak English, for that matter, which my son needs. So that's my question.
Oh, that's a great question. And I know Connie and Harvey, and I mean, all of our speakers, remember, everybody, I just want to point out that there are no set rates, there are no set wages. that everything is negotiated. So you can ask, you can pay someone more, have them work fewer hours. You can also pay them privately as well as pay them through the self-determination program. And you're calling that supplementing their wage. I don't look at it that way. I look at it as you're paying for them privately, but you're also hiring them through the self-determination program. So, you know, I think there are different ways, but I'll turn to Connie and Harvey, Howard, Rick, if any of you want to answer that.
Yeah, because I also wondered, is it legal? Because I actually asked an FMS person, a management person, and they're like, well, nothing's really written in HCBS about doing this. And this problem could create, I admit, disparity if, you know, people start increasing salaries. But I'm curious what you do about it when you're impacted with, for example, IHSS.
Yeah, so you are not actually allowed to supplement the wage of IHSS. We're talking about self-determination here, which is under a different set of rules. IHSS, the reason you're not allowed to supplement the IHSS is not because of federal rules, it's because of union rules. IHSS workers are in SEIU, which is a Service Employees International Union, and they have negotiated a wage, and that wage cannot be supplemented. That is very different than self-determination. So, but there are creative ways of getting around that, but it also creates disparity. So go ahead, Connie. I think you wanted to say something, or Harvey.
So this is a battle I've been having all along. We can't find people under IHSS wages that will even work with our son. They're not trained, and
they're not allowed to go in the community, really, except to go to medical appointments or dental.
And I'm really glad the other Connie raised this issue, because we've been trying to get exceptions, because there are people that won't work for that. Now, I mean, now with COVID, I don't know what it's going to be like, but you have to use generic services. So that's where IHSS comes in. I don't have the answer, and I wish I did. Rick, I don't know if you want to talk about it, but it is a big issue, especially, I mean, my son's on a health and safety waiver, and he has a lot of 2-on-1s. But even with, and when you get a health and safety waiver, part of the reason is that you need to pay more to your staff. We couldn't find him. Harvey's book, Green Book, I wish I had time to tell stories, but it's something we all have to work on. And I know you can't supplement it. So I don't have a great answer. I don't know if, Rick, you want to talk about it, except maybe move to Mammoth where there's...
Then you can't find them.
Well, look, this is the biggest issue. It's the hardest question, and because you can in the world there are typically competing services or competing people who are delivering services that you can choose from, in almost every category except for care provision because of the low wages. And so my view is this, and I know that there are people with regional centers on this call because I can recognize some of the names. So put your hands over your ears. And yeah, there are three ways in my view to get around this. One is, in our particular area, there are no IHSS employees who qualify to care for my child. And that, I think, is true in a lot of cases. So if you've got somebody that's very complex, somebody who has to have a CNA, who's got the medical training, minimal as it might be, to care for somebody who is at risk physically, most IHSS workers don't qualify. Number two, I may be wrong on this, but I believe about 70% of IHSS workers are parents. They're parents of children. So the way that I would phrase or set this up in a self-determination plan is that even though the generic service is available, you can't use it. It's available, but you can't use it. Just because it's out there doesn't mean that you have to use it. You have to persuade the regional center that's going to approve this plan that IHSS doesn't work for any number of reasons. Maybe there aren't enough people in the area. Maybe there aren't any. The reality is that you're not going to be able to get people at IHSS wages anywhere, probably anywhere in the state. And even though we're in this little isolated area, our wages are urban, suburban type wages because we're so tiny and the number of employees are so small, and the community pays more than what a lot of, certainly more than IHSS. There isn't anybody in Mammoth that makes, likely no one in Mammoth makes less than $16 an hour. That's not IHSS wages, and it goes up from there. And so my point is that this is an opportunity to be creative in your plan, because I see it as an unmet need. You've got this need for care provision. It is unmet by IHSS, and you've got to be able to get people. Last but not least, and I know Harvey and Connie know this because they've been doing this for decades, it's not just about attracting workers, it's about keeping workers. And you have to give them the opportunity to stay and take away the incentive to leave. And so it's the way you structure your plan. It's the way that thing is put together in the presentation that's made to the regional center. I know they don't want to hear it because everybody's stuck with this budget and we've got this generic services rule, but this is just a great example of how somebody who is creative can manage that minefield that I call IHSS. We have no IHSS workers in our, we don't supplement IHSS workers in our son's situation. Judy, unmute.
Yeah, there we go. Thank you, Rick. Sorry about that. That was really helpful. Lori Shepard. Hi, Lori.
Hi. You can't have a DBU meeting without me talking, right?
Oh, you're always welcome.
So I wasn't going to speak to this, but I will speak to Connie's question about the IHSS. Running a supported living agency, we also run into the same thing. So we tend to use, if somebody has protective supervision, we tend to use those hours for overnights as much as possible. We pay minimum wage for overnights through our agency. And even though in LA County, IHSS is sub-minimum wage, it's still closer to minimum wage than our awake paying hours. So we'll use IHSS for overnights when at all possible. I've heard people who will take their IHSS and say, okay, well, you got 20 hours a week of IHSS. I'm going to pay you for 10 other hours a week at a higher rate. So if I would have paid you 18, I'm going to pay you 20 because I know for those 20, you're making less. Kind of gets tricky if they stop working IHSS and want to keep working for the higher wage. So you have to watch out for that. And then as Rick alluded to, IHSS is often paid to families. And so sometimes you can give the IHSS to the parent, like Harvey and Connie, I would imagine, go to a lot of Sean's doctor appointments. They might do some shopping for him. They probably do some extra housekeeping around his house. So we can give them some IHSS hours, and that doesn't impact Sean's other budget where he's getting the qualified staff that he needs. So there's a couple of IHSS tricks for you.
That's a great IHSS trick.
Thanks.
I like it.
Anybody from North LA didn't hear me? No. But that's how we do it with supported living.
You guys, Connie and Harvey should do that.
Yeah, there you go, Connie. You get $500 extra a month to take out Sean's trash. Woohoo!
Yeah.
But what I was going to ask when I raised my hand the first time was this. I'm starting to work with families who are conservators, and I know that as a group here, we're all about shared decision making, but in reality, a lot of people already are conservators, and probably we're not going to go through the time of taking away conservatorships. So as we're working towards working with the FMS and hiring these independent facilitators and stuff, what is the risk? First of all, who's signing the papers? Because if you're conserved and your signature doesn't count, who is supposed to be signing? If it's your conservator, then how is it self-determination? Okay, so you got that going. And then if I'm the conservator and if I'm signing and we're all in agreement that I'm really kind of running the program using shared decision-making and person-centered planning with my child or whoever, what kind of liability is that putting on me, the conservator, as far as clearly if I fire somebody, it's, I mean, if you know, my kid fires somebody, it's really me firing somebody, and then, you know, is my home in danger? Is my IRA in danger? You know, do I need to be also insured on my child's self-determination thing? All of those kind of questions is what I wanted to ask.
Those are really important questions. I wanted to answer one of the specific questions about who is the employer of record when a person is conserved. because that's really important. So for those of you who don't know this, if you use the sole employer model, you are the employer of record, not the FMS. And so one of the big questions Lori had posed to me before this call was, can a person who is conserved be the employer of record? And I wanted Connie and Harvey to answer this. And also, I think that their FMS is on as well, GT independents, who can confirm this. But Connie and Harvey, do you want to say how you do it? Because I know your son is conserved.
Yeah,
He's
quickly.
conserved and the tax ID number is in his name. It's a limited conservatorship. Everybody knows in California how litigious it is. Obvious. I do know this, that an FMS can give you information, can on this can represent you. I think doing it the way we're talking, and I think it would also apply to supportive decision making. Anyone who would influence the person that we're talking about, the customer, could be dragged into it, whatever it is. I think what it does, you're not an agency, so you're not a business. You are a home care health recipient of federal and state money, and you're not in it for profit. I think there's a little bit of a sympathy card there, and that would help maybe. But as we all know, anyone can sue anyone.
But we felt it was more protective.
I like the fact that Sean is his own person.
I know maybe GT wants to add something, I don't know, but
If there, I know, I see a lot of people from GT on there. If anybody wants to unmute and make a comment about how a person who's conserved can still be the employer of record. Valerie, are you there?
Valerie?
I am. Hello.
Hi.
Many of you I haven't met yet. I am the California Director of State Services for GT Independents. And well, the beauty of self-determination is the empowering empowering individuals to make those choices. And we try to make sure that we can figure out how to make that happen legally. And it's also making sure that folks still feel like they have the space to stretch out and kind of own their own space in their own lives. So we can look at how to work those things. And I would actually have to take a look and step back and look at that particular point to make sure that I could respond from a place of knowledge. And I'm just making a note so I can let Judy know to provide to the group.
Great.
Did Harvey and Connie, did you guys make yourself also insured on the liability plan for Sean?
Oh, you're muted.
wait, yeah.
Go ahead.
At our point in life, okay, we have assets, okay? Yes, in our budget and spending plan, we have liability insurance, obviously. You can get workers' comp if you're renter or even a homeowner in your renter's policy or homeowner's policy. Definite on that. I'm ex-military, I'm USAA, and they're very, very good with workman's comp because they have a lot of vets that are need that kind of stuff. I'm not certain that if you were a co-employer, that if there was an incident and a disgruntled employee, if they wouldn't sue everybody above, no matter what. Listen, I have a buddy of mine who was a surgeon and poked his head in a room one time to say, "I'll meet you for lunch." And he was named because the question was, who was in the room?
Oh, right. So there was a question in the chat to me about if the person who is conserved, it doesn't really matter whether they're conserved or not. My son is not conserved, and my son is the employer of record to our staff. So it doesn't matter whether they're conserved or not. If they're the employer of record, they are still liable if somebody wants to sue. So I don't want to have everybody have this big difference between conserved and not conserved. The reason why my son is the employer of record is exactly because he has no assets, as opposed to me who has assets. That is the actual strategic reason why the person with the disability is the employer of record. Now, we do carry liability insurance and workman's comp insurance so that if a staff member gets injured on the job, we're good. We also have, if somebody does file a lawsuit, we're covered up to a pretty high amount of money. And so my son is protected, we are protected, but the employer of record is the one who's liable. And actually it was our FMS who told us your son should be the employer of record, and they do this around the country and they have experience with this. Anybody else want to comment before we move on to our next question?
Judy, that's exactly how I see it as well. The conservator acts in the place instead of the individual, but the individual is the employer of record. The conservator is making the decisions, has the authority to do so. The individual doesn't, but that person is the employer. In our circumstance, my son is conserved by me. I'm the conservator, and I am an additional insured on his work comp policy and the liability policy in the place that he is occupying. He's now not living at the home in the home any longer. If he were in the home, he would be covered under my liability policy as a member of the household. So I don't see it as I don't think it's that complicated, but and I get liability comes from all different angles or directions, including those related to employee issues, labor disputes, hour and wage disputes. And so it's not just somebody who slips and falls in your house or your son's or your daughter's house, or if you are on your own house. It comes from a lot of different areas, including from people that you owe money to for something. And so the point is, you buy insurance to cover, the conservator makes the decision, the individual is the employer of record.
Thank you. And somebody was asking in the chat, can a minor be the employer of record? No, we're just talking about adults here. We're not talking about if it's a child and you have a worker in your home that you're directly employing, then one of the parents or both of the parents are the employers of record. Okay, let's move on to Eliza, which I almost sang your name from Hamilton. Eliza. Sorry, you may be hearing that.
So I had a question. I am an independent facilitator in Kern County, and I'm encountering an issue where one of the vendors that we are trying to get approved for my client has not yet been found to be compliant with the final rule. I'm being told by the regional center that it's not that the client isn't compliant, it's just that they are not yet compliant. Like, they haven't been found to be compliant, if that makes sense. And so when I spoke to DVS and reached out to them, I was told that in some instances, the IPP team can come to a decision with the vendor where the client receives kind of a different type of service than their general population might receive at the vendor's area. And that means that then the client can move forward in self-determination. And so one of my questions, I guess, is it's unclear to me who the IPP team is at this point, if that is the client and if the client chooses to have their family, as well as the service coordinator and myself, because the service coordinator is telling me that we are waiting on an unknown amount of people, like undisclosed amount of people, to approve this process. And it just feels like there's a lot of barriers we're facing. So I just want input.
Yeah, those are great questions, Eliza. So one of the biggest issues with the HCBS compliance, so for those of you who may not understand this yet, HCBS stands for Home and Community-Based Services. There's a rule that came from, oh my goodness. Okay, no, we're good. I just saw a Ruth Bader Ginsburg warning, news alert. She's okay. She's okay. She's okay. We can all go on now. She's okay. This rule, they call it the final rule, which is a terrible name. I call it the inclusion rule. It basically says that everybody who receives services through the federal government funded by the federal government, and any regional center service is funded by the federal government, all of those services needs to allow full access to the community. So the setting that you're in has to allow full access, plus there has to be person-centered planning, plus there has to be individual choice of who you support, who supports you, and what you do every day. That rule was supposed to go into effect last March, then it got extended 3 years, now it's got extended another year, which is really infuriating to me. But the important thing is that people in the self-determination program must abide by that rule immediately because of a complicated thing called a waiver. I'm not going to get into it. The only thing you need to know is you must abide by it. So that means, so what are those services that are not going to be what's called compliant or follow the rule? They're generally going to be those services that you get in the traditional system. There are some exceptions. I'll give you an example. My son has been in a program, I'm Jewish, and my son has been in a Jewish program where the program is only for people with disabilities and the paid staff that are there. That it is not an inclusive program. We've known it all along. It's only an hour a week, but it is something he loves and he's been in for a lot of years. I could not put that in his self-determination program because it is an isolated program. It's a segregated program. That's unusual because we've been paying for that privately, but with more likely it's going to be a day program or a social skills program or a work program. Those kind of programs that are only for people with disabilities where you don't have free choice and there's no person-centered planning going on and you don't have full access to the community. And so if this provider is providing services in the traditional system in a segregated way or in a non-compliant way, they will have to prove that what the service they are providing through the self-determination program is going to look very different than what they provide to everybody else, even though, by the way, they're going to have to provide that service different to everybody else in a couple of years. So they should be changing their whole program. The problem is that people with that the DDS has not established exactly what that looks like for even the traditional system, which is very problematic. And so, and they've told the regional centers that they can do it however they want to with very little direction. So each regional center is doing it differently. Just to let you know, I'm sure there are people on this call who are part of this, but I was part of a person-centered plan recently where there was I felt there was a clearly non-compliant program being offered in the self-determination program and felt it was really quite risky for that individual to be asking for that program in their spending plan when in fact they had no free choice, there was no person-centeredness in that program. And so I think it's really important for that decision for it to be very clear what service that individual is going to be getting from that non-compliant program and to write it out in a contract. There are sample contracts or agreements, provider agreements on that same DDS website. And I would look at that to say, these are the exact things that this provider is going to be doing. So let's say it's a day program. They're not going to be going to the center-based program. They're not going to be hanging with all these people for part or all of their day. They're going to provide one staff member, and that one staff member is going to meet them at their home, and that one staff member is going to be taking them out into their community. And that individual, that participant chose that one staff member to do that. And if they decide they don't like that staff member anymore, they can choose a different person. So you have to be able to show how it is compliant and being done in a different way. Does that help you, Eliza?
It helps me, definitely. So kind of like getting a little creative. The other question that I have for you is the IPP team. So I'm being told, I can't come up with this by myself. According to DDS, it has to be a team decision. Right. But if it's unclear who the team members are, I don't know how to make that decision. Does that make sense?
Okay, so it's very clear who the team members are. It's in the Lanterman Act. Okay. The IPP team is the regional center representative and the consumer or the client or the self-determination participant and anyone that the participant decides they want on their team. So there's no like definition. So let's say the participant wants to have on their IPP team their family members, their independent facilitator, or their person-centered planner. They can invite friends, they can invite a teacher from school, they can invite, I mean, they can invite anybody they want to be in on their IPP team. Clearly for this particular decision, the service provider should be part of the IPP team because they have got to make a guarantee at an IPP that they will provide person-centered services with complete access to the community.
Okay, so if the regional center is trying to say, I'm sorry that I'm asking so many questions. If the regional center is trying to say that the service coordinator can be part of it, but then other people have to approve that decision, and then we're waiting on them to help us with this decision, is that allowed?
So the regional center can designate various people within their agency who needs to approve this. It's very possible that it will be a lot of regional centers have an HCBS person, so it might be that person who ultimately approves it, within their regional center. I think each regional center is doing it differently. So they may decide there is another person who needs to decide that, but you can ask for an IPP meeting just about this one issue. You don't have to wait till your whole spending plan's done, everything's done. You can have an IPP to just determine how this service is, whether it's compliant or not, and what it will look like. And then you can come back to have another IPP meeting where you're talking about the whole self-determination program. So I would definitely call immediately for that meeting, to just discuss that one service and what it will look like and making sure it's really compliant before you move forward. Okay.
Awesome. Thank you.
So before we move on to another question, because I know we're running over time, but I want to make sure we have everybody. Lorna, could you please ask if there's anybody on the Spanish line who would like to ask any questions in Spanish? So while she's doing that, I'm going to talk about things that are unrelated to this so that the Spanish speakers are not missing out on anything. I just want to remind everybody that our normal time for our SDP Connect call is usually 5 to 6 p.m. Last week, I asked people who were on the 5 to 6 p.m. slot whether they'd be able to make a 4 p.m. Meeting. Sorry, I'm coming up with the wrong word. We had about 5 or 6 people saying that the 4 p.m. was difficult because they worked full time and they couldn't get on. So now that we have the 4 p.m. crowd here, if you have a problem making the 5 p.m., let's say you have dinner or you're preparing things for your family or yourself, if 5 p.m. is a problem, if you could just put something in the chat so that I get a sense of whether that 4 p.m. is a much better time slot, and we may go back and forth between 4 and 5 p.m. just to try to help people. Okay, so I'm going to go back to you, Lorna. Did anybody have a question?
I have a quick question.
Yes.
Lenny. Yeah, I haven't been in an SD meeting for so long, so I forgot. What is the charge for the FMS, and is it out of the budget? And
so
what's it stand for? Financial something?
Yes, so I will be back with you in a second because I have an order of people asking questions. You need to, I'll remember you, Annie, but
I put it on the chat. I put it on the chat already, but somehow
great.
You didn't have time to look at it.
Okay, great. No,
you can send it back to me later.
Lorna. Okay, so I'm going to ask for Trudy Grable right now.
Hi, everybody. Am I unmuted? Yes. Okay.
Yes, you are. You're perfect, Trudy.
Thank you. I want to inquire, this is more of a question for people who are present at this meeting. Your experience with the person-centered plan itself. When I'm developing a plan, I always include instructions for supporters around different areas of life. I never use checklists, but I've seen plans with plenty of checklists, and I'm just wondering, and maybe Suzanne, she's seen different kinds of plans, can speak to this as well. If people are including that, because we have staff turnovers, we have people who are sick, and you might have a pinch hitter for that night, somebody who doesn't know the individual. And they may read that, oh yeah, this is what the person likes to do, and this might be their vision for the future. But what about how to interact with that person? How does this person communicate? How do you communicate with this person? With real examples of like what to say, what not to say, instructions. I see checklists for hygiene, but it doesn't tell people what kind of help they need. And I feel very strongly that it needs to be in the plan. And I'm wondering if other planners are doing that, or if I'm just knocking myself out. So thoughts, I would appreciate other people's thoughts on that.
Thank you, Trudy. I know we have a lot of person-centered planners here. Does anybody want to, I know I've certainly seen that in our plan for sure. And I can tell you that Lori Shepard, who supports my son in certain ways, she encourages a communication dictionary and, you know, really to write out, this is the way I like to be supported. These are my preferences, so that when you have new staff, that folks are, you're not unusual. However, I think there are some people who can learn. I mean, people were not on our program a couple of weeks ago. Trudy is like a god when it comes to person-centered planning. And so you know, I go back, I encourage people to go back and look at our recording from 2 weeks ago. You can find them all on our YouTube channel and on our interchange, which I'm going to ask Ed to throw in those links in the chat. But you should definitely watch that particular SDP Connect. Lori, Suzanne, Sunny, anyone want to make comments on that?
I think a lot of people here could make comments who are person-centered planners as well. But I think Trudy asked me because I have 3 children in the self-determination, two are adult children in the self-determination program, and I had 2 different kinds of person-centered planners. And I do think that just like everybody has needs in terms of accommodations, that they can look very different. But I agree with what you said. Those things are very important. And we know it's those little nuances that can make the difference completely for our person. So I do agree with that. And I think, you know, some are more, you know, colorful, and I mean, there's so many different ways that you can do a person-centered plan, but the point is that it's really reflects the person and their needs. So yeah, it's not a one-size-fits-all, but I know the people here with so much experience have seen probably a gazillion person-centered plans. So
Connie?
Oh, I mean, I didn't hear her from before, and I know it's a really good question, really important. But for me, because my son does not communicate in a typical way, and he hates meetings. All meetings were about how bad he was. And so we had a real struggle trying to figure out a person-centered plan. So for me, and this may be obvious, I hope that, you know, because I hear you're, you know, really great at this, it's the pre-planning. We spent as much more time in the pre-planning. We had a pre-planning, then we had a pre-planning, and then we had the actual person-centered plan. Because there's so many variables, and there were people that felt that they should be at that meeting that Sean didn't want. So it's the struggle is before. It certainly makes the difference between what a PCP is and an IPP. I will say this, at this point in our evolution and self-determination, I'm so glad nobody is saying, oh, the PCP and the IPP are the same. And so my point is that you really need to pre-plan and mitigate that, because you want it to be successful and you want them to be in charge.
That's great. Well, I don't know, Lori, did you want to mention anything on this too, or are you good?
Well, I'm never good. I think that I think that people are using the person-centered plan for different reasons. Some people are using it because the regs, they don't exactly say, but they kind of say that you need one and regional center wants one. So they're doing a 2 or 3 page thing and they're getting it turned in and they're checking it off their list. And if that's what they're using it for, and it doesn't really say much except for what services we want paid for. And everybody acknowledges that that's what it is. Most of us wouldn't really call it a person-centered plan per se. It's certainly not a whole person assessment, but that might be functional for what they need it for. For those of us that have been doing PCP way before SDP came around, we see it as a viable tool for a whole bunch of other reasons, including training and history and you know, detailed planning. That's when we want to get, like Trudy's saying, past the checklist and really put in some details. So I don't have a problem telling a potential person who wants their PCP because they just want SDP that yours is going to look smaller. It's not going to have 30 pages in it. It's not going to have all these details. I'm going to give you what you want, and my fee is going to reflect that, versus some of the other people that we want to be more involved with, and we want to get the details out there, and we want to set up the moving forward part of the plan. Those ones are going to take more time, the pre-planning, like Connie's saying, and they're going to be a lot more detailed, and to me they're going to be a lot more functional. But we do have to look at what people want to get out of. Very few documents in self-determination have a real detailed description. So we really need to see what does the family want to get out of this particular piece of information, and then give them that, give them some education about what it could be, but ultimately give them what they want.
Judy, I want to add, if I
go ahead, Rick.
You know, Lori, that was just so well put. They're all different. And there are biases that are brought to the planning process by the planners, but ultimately it's a function of what the desires and needs are of the individual. What we have found in the program in the pilot over the years is that the initial plans were extremely detailed and went on, and it took a long time to get them going. Then they got easier the second year, and then they got easier the third year, and then by the time you got to the 10th year, they almost felt like you were checking boxes, which is really interesting. So the pendulum swung a lot, unless of course life circumstances changed, because people got used to what they either wanted or needed, and so they simply stuck with it. And so in some respects, plans in later years can become stale. But as Lori said, if they function, if they work for the individual, and if you're thinking about that, then it can be a short plan or it can be a long plan. The other thing that I would mention is that we have always used in our family. My son has 2 siblings. We've always used that annual planning process, which did not take just an hour. We sat around on a Saturday afternoon to redo it. We've always used it as an evaluation of our family's life. And it wasn't just his life, it was the entire family. What went right? What went wrong? What can we do differently? Some of those were painful. And because, you know, that's families. And he is the youngest. One of his siblings was 10 when he was born, and one was 5. And so we got 10, 5, and 0, or, you know, 5 years apart. So my point is that it's just a wonderful tool. It's just how do you want to make use of it, and what do you want to get out of it?
Great. That's really helpful. We need to end. We're already over. I think but Connie Boyer, did you want to add something? Go ahead and unmute.
I actually had another question, but I'll try to make it real quick, okay? Regarding selecting IFs, how important do people think the knowledge base of the IF needs to have as far as resources? For example, my son lives right on a county line, but you know, we're in one regional center. And I'm talking about accessing maybe traditional services, not creating, you know, their own, but if you wanted to, let's say, do a combination of, because you're no longer needing to use courtesy vendorizations. How important is it that an IF have a wide range of knowledge regarding resources, or can they continue to use the regional center in terms of finding services?
So you at first said FMS, you mean an independent facilitator?
I meant independent facilitator, right.
I personally, and others I believe it is really critically important you have an independent facilitator who knows your community and gets to know you if they don't know you yet. I think it's really hard to have somebody in a different part of the state or even a different part of the you know, if you're in Orange County, you don't know resources in LA County necessarily. And so I think it's really important to have folks who can get you out there. Like, let's say you need exercise. You have a person who calls the local YMCA, finds out they have a sliding scale. So you get, you know, they negotiate a deal for you at the YMCA, or they get you a personal trainer because they know people in your area. I think it's really important. You can also, you know, go to your regional center, but they're only going to know about vendored services. There's not a single person at a regional center who would claim otherwise. They know who the vendors are, and they don't get involved in the non-vendors. And so if, you know, the point is you want to be able to take advantage of non-vendors here through self-determination. So you want somebody, I'll give you an example. Lori, who works with my son, not as an independent facilitator, just as a support person, we knew that my son likes drumming. Like he's got a really good, he's got a good beat. And so she just looked online and found these drum circles that exist that are free, that don't even need to be in your spending plan, that you can just show up at the beach at Thursday at 5 o'clock and you can be in a drum circle. And so those are the kinds of people I'm talking about who are going to be very creative. You know, Sonny did this for Howard, and Howard is very, very passionate about nonviolence and anti-bullying issues. And so Sonny, on her own, found the local chapter of the Moms Demand Action and got him involved. It doesn't cost money to get involved in the Moms Demand Action chapter or any kind of chapter for gun control. You need to have somebody who's going to, as Howard said, fight for you, know what your passions are, know what your interests are, and get out there and find you what you need to help you meet your goals. Not about vendor services and not about money. It's about not what's available. It's about what is possible in the world that can help you meet your dreams and goals. Okay. So all right, I'm going to end now because I have a meeting, which all of you are welcome to be part of. The Westside Regional Center Local Advisory Committee is meeting in 30 minutes. And if any of you are interested, I will put the Zoom link for that in the chat before I go. Because it's on Zoom, everybody can join in, and we get lots of people from around the state to come to our meetings. So I want to thank Howard McBroom. Happy birthday, Howard. I want to thank Harvey and Connie. Connie just celebrated her birthday last week as well. So we have 2 birthdays. Rick, is your birthday? Okay, we don't have Rick's birthday. But I want to thank all of our great speakers and our presenters today. We'll be back next week with another SDP Connect. I'm not sure exactly what time it's going to be because there's a lot of people who don't like 4. A lot of people don't like 5. So maybe we'll make it 4:30 so that everybody can be in part of it. And you can always watch it on video as well. We record all of this and it's all available and you saw it in the chat. So thank you, everybody. And I'm gonna, we can stop the recording now, Ed, but I'm gonna put in the chat the way people can get to the